Madam, we are live now. Shall we start?
Yeah, sure.
So, good evening, doctors and all the participants. I should on behalf of Shield discussion on stress and infertility. The link and our guest speaker is Professor Dr. V Radha, Madam. It's my honor to introduce Madam. Madam is the professor and head of the Department Reproductive Medicine and Surgery, Sri Ramachandra Institute of Higher Education and Research, Chennai. And Madam did her PhD in Reproductive Medicine and Surgery also, and she has a keen interest in the academics also. She published many papers in many national and international journals of well-reviewed, and Madam is the examiner for undergraduate and postgraduate section. So with this short introduction, I request Madam to take over the session, and meanwhile I request all the participants for your active participation, and please drop your queries on the dashboard or chat box of the Shield Connect page. So once the talk will be over, we shall have a short discussion on this very important topic, stress and infertility with Madam. So thank you very much, Madam, once again for your valuable time on our platform Shield Connect, and over to you, ma'am, for further proceedings. Thank you very much.
Yeah, good evening, everyone. I thank Shield Healthcare for giving me this opportunity to speak on a very important topic, that is stress and infertility. Let me share my screen. Yeah, this is one topic which is neglected, I should say rather. When the patients, they come to the outpatient, they would have visited many clinicians, and then they would have had a big list of investigations being done, and they know what is the problem, but how to deal with that, the stress factor, which is not concentrated much upon. So today I thought I should present on that important topic. And so we all know that infertility is defined as failure to conceive after 1 year of unprotected intercourse with the same partner. And the incidence of infertility is rising, and in India it is around 10 to 15%. And some of the studies that do quote as 1 in 6 couple, they fail to, or they need some form of support or assistance to conceive. About 30% of infertility is purely due to male causes, and in another 20% of the cases, both partners are detected to have abnormalities. So if we combine together, almost the male factor contributes to 50%. So we should say that the one of the causes of infertility per se is not due to female, it is equally shared by male and female. So many couples who are young in India, they are diagnosed with infertility. So the incidence of male infertility is increasing worldwide. This can be accounted to the food habits, the stress factor, and also various other, the junk food, the lifestyle. All this can contribute. And of course, stress also can be one of the contributory factors for infertility. So just wanted to know, can stress be a contributory cause for infertility? Yes, stress affects fertility, but people were unable to discover why and to what extent. So this is what we are going to discuss, how stress is going to be one of the contributory factors for infertility. Now, when a couple comes to your clinic and you say that there is infertility due to some causes which needs to be evaluated, they will have some sort of emotional disturbances, and each one of them, they respond in a different way. They take it as, some of them, they take it as a surprise. Some of them, they deny it. Some of them are very angry on themselves or with the other partner. They may have some frustration, isolation, and they will also have a fear how to face a society, and they feel that a sense of lost feeling, and some of them are even shocked to listen that there is some factor which is inhibiting them from conceiving. So when there is stress, what is happening is there is activation of the sympathetic nervous system and the hypothalamo-pituitary adrenal axis. So when the sympathetic nervous system is activated, there is release of epinephrine and norepinephrine. And when the HPA axis, that is the adrenal axis, is activated, there is release of the corticotropin releasing hormone from the hypothalamus, which in turn leads to the secretion of ACTH from the anterior pituitary and the glucocorticoids from the adrenals. So all this can increase the cortisol levels, which in turn leads to increase in the glucose levels to cope up with stress. So we all know that glucose is one source of energy which is required. So how it happens? It is in the liver, there is gluconeogenesis, there is mobilization of amino acids from the muscles, and there is lipolysis in the adipocytes. So when there is stress, what happens? They tend to have a lifestyle behavior maladaptations. Like some of them, they may start having this habits of smoking alcohol, and some of them they can also have like a change in their lifestyle behavior. And stress can lead on to the generation of ROS, and it can reduce the oocyte and the sperm quality, which we will be talking a bit later. It can reduce the fertility, and stress can have poor IVF outcome and release of the stress hormones. These are some of the changes which can happen when a couple is facing with the stress. We all have faced this situation, which is living like an example. Many of the couple and almost all the population people have faced the stress during COVID-19 pandemic. So in the initial part of COVID-19 pandemic, many of them, when they were in the initial phases of lockdown, they had some sort of relaxation, reduction in the stress. So many of them who were undergoing IVF treatment, in the initial phases, they started conceiving spontaneously. But the same trend is not happening now, because it is adding on to the stress because of the lockdown, which is leading on to the chronic stress. It is also having an effect on the adverse health outcome. And many of them inadvertently, they have some form of psychological distress, and it's a powerful source of anxiety, stress, sleep disturbances, nutritional changes, weight gain. And some of them, they also have some problems with the job satisfaction is not there, or overwork. All this is adding on to the stress. So this problem of infertility is rising again. Now, it has an impact on the women's health. Specifically, it acts through the hypothalamo-pituitary gonadal axis dysfunction. And so it can lead on to the menstrual abnormalities and the ovulatory dysfunction. So these dysfunctions, they can manifest in the irregularities. Some of them, they can present to us with infertility due to hypothalamic hypogonadism. So what is happening in these patients? There is a link between stress and reproductive dysfunction, which is very well established. And the psychological stress, which is experienced by the infertility couple, they are associated with the lower conception rates. So they can compromise every aspect of fertility, including libido, sperm quality, ovulatory capacity, and even implantation. So we'll go into what is the neuroendocrine changes which can happen with stress. First and foremost, we'll talk about is the hypothalamo-pituitary adrenal axis. So what is happening here is when there is a stress, the CRH and the AVP neurons of the hypothalamus, they receive the inputs from several brain regions. So there is release of the corticotropin releasing hormone into the medial eminence, and the CRH acts on the anterior pituitary through the CRH receptor type 1. And so there is release of this ACTH and the pro-opio melanocortin, which is also called POMC, into the circulation. So ACTH will stimulate the glucocorticoid release. So this glucocorticoid is going to regulate the glucose and the fat utilization, storage, memory, immune function, and other stress coping functions. So this glucocorticoid release can have a negative feedback on the glucocorticoid and the mineralocorticoid receptors in the hypothalamus and the hippocampus, and they further suppress the HPA axis activation. So this is the pathway how it is going to act in the hypothalamo-pituitary adrenal axis. So where there is a CRH release which acts on the anterior pituitary, so there is release of ACTH, which in turn can lead on to glucocorticoid release, which can negatively suppress the HPA axis. Now, what happens with the stress in the hypothalamo-pituitary gonadal axis? So in this, the hypothalamic medial preoptic area, that is the kisspeptin neurons, are stimulated, and there is inhibition of the gonadotropin inhibitory hormone neurons. So what happens here? There is release of GnRH in a pulsatile manner into the median eminence. Then the GnRH, it stimulates the release of the gonadotropins, that is the FSH and LH, from the anterior pituitary, and this is going to act on the ovaries. So in females, there is release of the ovarian steroids, that is the estrogen and progesterone. This can carry out both negative and positive feedback actions depending on the stage of the ovarian cycle. And in males, the gonadal release of testosterone, it produces inhibitory action on the GnRH and the gonadotropin secretion. So there is a negative feedback. So when there is intersection of both HPA and the HPG, that is a gonadal axis, so what happens? The CRH can directly inhibit the GnRH pulse generator. So there is suppression of the pituitary gonadotropins, FSH and LH, which in turn results in the decreased oocyte maturation or diminished oocyte maturation and steroidogenesis. And the corticosteroids, like the glucocorticoids, they can act directly at the level of pituitary and suppress the gonadotropin release, as well as exert suppressive effects within the gonad. So the CRH releases from the paraventricular nucleus of the hypothalamus, that it activates the locus coeruleus neurons. So there is increase in the noradrenaline production. This stress-induced increase in the sympathetic activity can then increase the sympathetic innervation of the ovary. So there is development of ovarian cyst formation. Now, what is the effect of stress on the menstrual cycle? So in women, typically the phenotypic markers of chronic stress can be any form of menstrual irregularities, amenorrhea, or infertility. As I said, it can be due to hypothalamic hypogonadism. So some of them, they can have a longer cycles, some of them can have a shorter cycles, or some of them it is not affected. So there is no association of the stress and cycle length in some of them. So there can be varied type of presentation. So the stress can induce anovulation. How it is, we will see. So the studies have shown that stress-induced anovulation, that is a functional hypothalamic amenorrhea, is seen in almost 34% of the patients who are presenting with anovulation or amenorrhea. So what happens with the stress is there is hispeptinergic system which affects the hypothalamo-pituitary gonadal axis and the GnRH pulsatility. The leptin, insulin, and CRH, they are the key modulators of behavioral response. So they both can affect ovulation. So how it affects, because the chronic stress, I said, it acts on the HPA axis. So there is increase in the level of cortisol and the CRH, and increase in this hormonal levels can suppress the normal levels of reproductive hormones. So they can lead to abnormal ovulation, anovulation, and amenorrhea. With adequate estrogen levels and stress-induced activation of this HPA axis, there is increase in the amount of LH release. So what is happening with the increase in the LH? There is associated increase in the adrenal progesterone. So which can again have a negative feedback on the gonadotropins in the pituitary to decrease the LH that accompanies the release of cortisol in response to stress. So the progesterone can stimulate the LH secretion by acting directly on the pituitary. Now, so during stress, there is stimulation of LH secretion, which we already discussed, and this can also provoke a premature LH surge and thereby interfere with the proper follicular maturation and ovulation. This increase in the LH concentration at different stages of menstrual cycle, it can have conflicting effects on the maturing follicle and on the development of the oocyte. And some of them, in the increased LH levels, they can result even in early pregnancy loss. So what is the impact of stress on oocyte quality and the reproductive outcome? So when there is increase in the cortisol level and the oxidative stress levels, they affect the granulosa cell function, probably by inducing apoptosis. So this leads to decrease in the 17-beta estradiol biosynthesis in the ovary, which in turn can lead to decrease in the growth and development of the follicular oocytes, and they can induce oocyte apoptosis. So there is deterioration of the oocyte quality, and there will be poor reproductive outcome. So it can also have effect on the endometrial receptivity. So we saw its effect on the ovulation, on its effect on the menstrual cycle, and how it is affecting the chances of implantation. So the stress can have effect on the endometrium as well. We know that endometrium has a very important role for providing the site for implantation of the embryo and maintain the normal development and survival. So the recent studies have shown that stress is also one of the common factor for development of unexplained reproductive disorders. So what happens in these patients? The non-receptive endometrium and disturbed early maternal-fetal interaction can lead to infertility, like recurrent implantation failure, recurrent spontaneous miscarriages, or late pregnancy complications. So they can affect the quality of life as well as the psychological status of the individual. So what is happening due to stress on the endometrium? So we saw that there will be increase in the release of the stress hormones, and also it has effect on the hypothalamo-pituitary gonadal axis. So there is these stress mediators, they have effect on the on the endometrium and can have endometrial dysfunction. So they lower the GnRH levels. There is alteration in the FSH and LH ratio, and alteration in the secretion of the estrogen and progesterone. So what happens with all this? There is inhibition of the epithelial and the stromal cell proliferation, stromal cell differentiation, and there is altered endometrial gene expression and impaired endometrial receptivity. So all this, they can affect the embryo implantation and further continuation of pregnancy. So coming to what is the effect of the stress and the reproductive function. So when there is stress, it affects all the levels of the reproductive axis. So at the level of the brain, that is the ventral tegmental area, they can suppress libido, reward, and the mating behavior. At the hypothalamic level, it interferes with the GnRH release, and at the pituitary level, that is the anterior pituitary, it interferes with the release of LH and FSH secretion, which in turn acts on the ovary. So it can interfere with the oocyte maturation, ovulation, steroidogenesis, and there can be ovarian cyst formation, which we saw a few minutes back. And on the uterus also, it can interfere with the endometrial receptivity, so they can affect the implantation and pregnancy outcome. So on the gonads, they suppress the oocyte maturation, ovulation, and hence there is increase in the chances of cyst formation, and they also affect both the ovarian and the testicular steroidogenesis. And on the conception, it has got a detrimental effect to the pregnancy outcome. They reduce the likelihood of the successful blastocyst implantation. So on conception, what can happen is this glucocorticoids, we all know that it has a very important role throughout pregnancy. So when the maternal glucocorticoids are elevated, they have an effect on the fetal development. So, but when there is exposure to excess of glucocorticoids due to chronic maternal stress, there is development of metabolic disorders and increased risk of emotional and cognitive disturbances later in the life of the newborn. So coming to the effect of stress, what is the reason for stress due to the IVF procedures? So we know that when a couple is coming for an ART program, they need to go through, it is not a procedure which can be done in a single day. It is going to be in a structured manner. So they have to take off their time from the regular work schedule to meet the doctor. And they have to have multiple tests and the blood investigations, say on a day 2 or day 3 of the cycle. So it has to be given a priority. They need to undergo pelvic examination, ultrasound examination. They have to come for the daily injections. And also, suppose they're planned for an IUI procedure or a natural relationship, they have to time the sexual intercourse. And they have to undergo various diagnostic procedures like laparoscopy or hysteroscopy in case required. And above all is the cost factor. So all this can lead on to the stress due to an IVF procedure. So the ART treatment replaces an additional physical, emotional, and the financial burden of stress, particularly on women who are often exposed to these invasive procedures, which are to be as a part of the treatment. So stress reduction interventions, they can reduce the negative effect, and in some cases, they have improved the IVF outcome. I'll be showing some of the studies also regarding this. Now, the pre-existing psychological conditions like anxiety, depression, the high levels of distress, they also can have negative effect on the ART outcome. Already, if it is pre-existing, it can have an effect on the ART outcome as well. So these patients who are prone for anxiety, depression, or high levels of stress may particularly benefit from the psychosocial support during the treatment. So we saw about its impact on the female infertility. Now, what happens on the male? The stress effect on the male infertility, it has got an effect on the semen parameters. According to ASRM, the infertility affects men and women equally. So we discussed about that initially itself. And the semen quality is one of the key indicators of male fertility. So men who feel stressed, they are more likely to have lower concentrations of sperm in their ejaculate and with impaired motility. This is very, very important. So we all see that is one of the reasons which we can attribute in our younger generation, many of them going for the IT work or the shift duties. So they have a lot of stress. Of course, any job for that matter has a lot of stress. So this is likely to have an role, the concentration of the sperms in the ejaculate and also the motility. It may trigger the release of steroid hormones like the glucocorticoids, which in turn, they can blunt the levels of testosterone and the sperm production. Another possibility is the oxidative stress, which has been shown to affect the semen quality and fertility. So let us see a few things. What is the effect of this increased ROS, that is the reactive oxygen species, on the sperms? So when there is increase in the ROS, there is oxidative damage to the normal sperm DNA protein and the lipids. So there will be sperm dysfunction. And it can also have the increase in the sperm damage because we know that there is increased amount of polyunsaturated fatty acids in the plasma membrane, and there is decreased concentration of the scavenging enzymes in the cytoplasm. So all this they can contribute for the sperm dysfunction. And this increase in the ROS can also have the detrimental effect on the fluidity and function of the plasma membrane, and it can also have an effect on the integrity of the DNA in the sperm nucleus. So when there is increase in the ROS, they are known to have increase in the DNA damage. So that is what we are going to assess by the DNA fragmentation index. So they'll also, this leads on to the accelerated sperm apoptosis, which in turn leads to decrease in the sperm count and male infertility. So there are some studies where they have seen the effect of emotional stress on the sperm quality. So in this study, they have selected all male patients with idiopathic infertility after evaluation of the psychological stress to evaluate the positive effect of stress therapy on the sperm quality. So here, patients with the idiopathic infertility, they were selected after they have been evaluated for the psychological stress, and then they were subjected to stress therapy to know what is the effect of the therapy on the semen quality. So here in this study, they showed that the necrosis and apoptosis, they were higher, and the number of healthy sperms were significantly reduced in stressed men compared to the standard reference values. So, and after therapy, they found that the number of healthy sperms was significantly higher in the treated group, indicating that there is recovery of the sperm quality. So the effects induced by the stress also seem to include the meiotic and the structural alterations in the sperm cells with apoptosis and necrosis. This is another study which has been published recently. So where they have found the effect of psychological stress on the fertility hormones and the semen quality in male partners of infertile couples. So here they have taken the index of hospital anxiety and depression score, and they have taken a cutoff value of 8. So when they studied the population about all the hormones, they found that the testosterone levels are significantly lower when this HAT score is more than 8. And so these men, they have very low serum testosterone levels and a higher FSH and LH than patients with a normal HAT score. So I said the cutoff value of 8 was taken, and the sperm count, motility, and morphologically normal spermatozoa, they were lower in persons having abnormal this HAT score. So after seeing all this, I'm not going into the depth of what all the various parameters. There are various studies with the contradictory results. So there are some studies which have shown that the raised cortisol level are seen in infertile women. So we know that this cortisol level is influenced by various factors. So some of them, they say that you have to measure it in the early morning sample before the patient gets up from the bed, which may not be practically possible. And some of them, they, for uniformity's sake, they say that you have to measure it on day 2 or day 3 of the cycle in the early morning. So there are contradictory results that the cortisol levels have been increased in infertile women. So another study where they have measured the salivary alpha amylase level. So these women with stress, they had significantly higher levels of the salivary alpha amylase. Even the serum cortisol levels, other than that, you can check even in the saliva as well. So these women, they have, so these women, they have a higher time to pregnancy and increased risk of infertility. So in this study, they assess the salivary alpha amylase levels and the time taken for pregnancy. So those women who had a higher levels of salivary alpha amylase, they took a longer time to become pregnant, and the risk of infertility was more in these women. So there are various ways to reduce stress. So there are like the cognitive therapy, the psychodynamic therapies, the group therapies, and so on. So very, very important is we have to counsel these couple. Very, very important. I use the word couple. It is not the counseling is not only for the male or the female partner. So what is happening, what is the problem has to be discussed in detail with the partner. That is very important so that they don't blame each other. And remember that we have to tell them that they are not alone. There are so many patients do suffer from this, and you are trying to help them out. So you have to gain their confidence. That is very, very important. And talk to the people with infertility through individual or couple counseling or support groups. So there are some places where they conduct this group counseling so that they can help the couple understand each other. And they also have a feeling that they are not the only ones who are suffering. So the support groups are also there, and they should be encouraged to read books on infertility, which will also help them in reducing the stress levels. And other stress reduction therapies like meditation, yoga, or progressive muscle relaxation or acupunctures have also been tried. But this requires a lot of motivation for them to do this meditation, yoga. So they need an instructor or a trained person who can monitor them either online, or they can be asked to come and attend the classes. So these are some of the stress reduction techniques. And they also have to be told to change their lifestyle. They need not be isolated and depressed. They have to get into their normal routine activities, avoid taking too much of caffeine and other stimulants, and regular exercise is very, very important. This can release the physical and the emotional tension. So this is a study which was done in 2020. So where they said that the effect of psychological distress on IVF outcomes, is it a reality or a speculation? So in this study, they found that the rates of stress, anxiety, and depression among the IVF patients was significantly higher than the general population. So if the infertility related stress is higher, then the IVF success rate automatically it becomes lower. So these are the findings of this study. They indicate that there is a need for specific psychological interventions for all infertility women so that they can improve the IVF success rate. This is another study which is published recently in 2021, where they have found the prevalence of depression symptoms among the infertile women. It's a systematic review and a meta-analysis where they found that the prevalence of depression among the infertile women was higher than that of the general population of that country. Especially it was more so in the low and the middle income countries. So appropriate measures, planning and policies which target the negative effects of depression on these infertile women, they should be established to reduce the infertility related problems. Now, this is another study where they have done the stress management in the patients undergoing ICSI. So they found that these patients, they may slow down the first embryo cleavage and accelerated embryo compaction. So this is something interesting which was published recently in 2020. So here they found that this stress management therapy, it seems to be efficient in reducing the stress in these patients undergoing ICSI cycles. And it may also influence the granulosa cell physiology and embryo developmental kinetics in the participants, and they have had a good prognosis. So what is the efficacy of the reduction of stress before fertility treatment? There are evidences that personality dimensions, coping modes, and the stress susceptibility and resilience, they correlate with the IVF outcome. There are recent studies which indicate that stress increases the dropout rates, and the psychological interventions like the behavioral treatment, which are aimed at reducing the stress, have shown to be very effective by several studies. So in a recent meta-analysis also, they have showed that psychotherapy accompanying the IVF treatment also is very effective. So what should be the short-term goals for this infertile couple? According to the study, they have said that the reduction of feelings of helplessness through coping with infertility, there should be change in the sexual behavior, modification of the negative cognitions as to infertility, and overcoming the deficiencies in knowledge about fertility, and improving the marital communication skills. So this is some of the algorithms and which have been proposed by various studies. So what they say to improve the outcome, this is a flow chart which they said I thought it might be useful. So when the diagnosis of infertility is made, so first thing we should do is to establish the male and the female chronic and the acute stress levels with the validated questionnaires. There are various questionnaires. So if we are planning to follow these questionnaires, probably those which are validated or some of them are available on the net, which is suitable for our situation, that should be selected. So a counselor can be advised to talk to the patients to assess the amount of stress levels, acute and chronic, through these questionnaires. And these questionnaires, they give a threshold. If it is over a threshold value, then intensive stress reduction therapies should be given for 3 months. It can be any behavioral therapy or some of those group therapies and so on. And again, you reassess them after 3 months and establish the stress levels, and then you refer to the fertility clinic if the stress levels are reduced. If you find that the stress levels are still high, that is with the psychological and biological assays, then if you still think that the threshold is higher, then you have to go for an intensive stress reduction therapy through psychological adjuvants or the dietary treatment for 3 months. So when we find that there is reduction in the stress levels, then there should be initiation of the fertility treatment. So this stress treatment should go in hand with the infertility treatment. Now, what are the interventions for the stress control and fertility treatment? We can consider under various headings like the procedural means. That's a protocol to include the patient selection according to the chronic stress levels and the response to the acute stressors. and the preliminary treatment to reduce anxiety and depression before fertilization, the IVF cycles are initiated. So these are some of the procedural means which can be followed. And the psychological means like the cognitive behavioral therapy, the relaxation training, and differential orientation as to infertility, and sabbatical permit if they are going for infertility treatment. And the technical problems. So many of us in our IVF day-to-day practice, we know that when we ask these patients to give a sample on the day of oocyte retrieval, they may not be able to give, or the sample may not be proper. That is, it may not be of good quality. So in those cases, so we advise them to have a backup sample, that is the frozen sample, when the stress levels are low. So probably before you start the IVF cycle, when they have come for the initial workup, and you can have a backup sample of semen, even though the semen analysis reports are normal, because there are situations where when they are asked to give us a sample that at the time on the day of retrieval, they may not be able to give a sample. So in that situation, it adds on to their stress also, because we have the oocytes already, and if they are not able to give the sample, we will have to either go for freezing of the oocytes or so many other problems. So it is better to have a frozen backup sample when the stress levels are low. So that is one of the measures which can be taken. And further refinement of these fertilization techniques, so we can adapt the recent modalities like the acrosome reaction, all that can be tested, and even many of them are going for Efficacy nowadays for all the patients. The neurobiological means like establishing the individual baselines and the specific stress markers, and establishing the thresholds for referring, and monitoring for stress before and during fertility treatment. So this is another meta-analysis which included 21 studies, which reviewed the efficacy of the psychological interventions for infertile patients from 13 studies, of which the 13 studies, they reported the pregnancy outcome, and they showed a significant positive impact of these interventions like counseling, cognitive behavioral therapy, mind or body orientation, relaxation, education, then psychodynamic and psychoanalytic therapy on pregnancy rates. So this is something which is very interesting, because if you have a counseling facilities and these psychotherapy options are available, probably this can be utilized, especially in patients with recurrent implantation failure. So it may have a role. This is another meta-analysis of 22 studies. They also have indicated a positive effect of psychotherapy on conception. In this analysis, they found 45% of the subjects in the intervention group, they reported pregnancy by the end of the study completion, compared to only 14% in the controls. So this is something which is very interesting, and it can be looked into. So I would like to conclude that stress has a significant role in infertility. It can cause infertility and have a negative outcome with IVF. So it can have its effect on the menstrual cycles, ovulation, and the endometrial receptivity. And in the male, it can have effect on the semen parameters, like they can have decrease in the motility and the concentration. And infertility treatment further can cause stress to the individuals. And this can be avoided probably by proper counseling of these patients in the counseling session, where they should be told and they should be aware these are all the treatment steps they are going to go ahead, and what are all the probable complications, what is the success rate, what is the alternative, and above all, you should tell them what is the appropriate cost of this procedure, so that they are mentally prepared. If it is not informed to them clearly and they are not able to cope up with all this, it adds on to stress. So counseling before we start the ART treatment is very, very important, and this can have effect on both the male and the female fertility. So all counseling, all couples, they should undergo counseling, and they should receive safe and effective treatment for stress. And IVF protocols, they must include some anti-anxiety and anti-stress treatments in the couples. We cannot give all of them the medications. Probably the counseling and various other, this is the reality. Once they come to know that, they will be able to accept it. Thank you very much for your patient hearing.
Thank you very much, ma'am, for this nice deliberation. Just give me 1 minute time, ma'am, to check the questions in our dashboard.
Yeah.
Madam, one question that whether stress management will have some impact on usage of gonadotropins in case of this infertility treatment for IVF couple, you can mention.
Impact on what? Gonadotropins?
Stress management, ma'am.
No, stress management per se, if you are giving some form of therapies, it is going to reduce the stress. So whatever I had shown you, the effect on the axis, the decrease in the gonadotropins, it will be alleviated. So it is going to correct it and it is not going to worsen the situation. Stress management therapies are mainly focusing on reducing the stress level so that it helps in the hormonal milieu also gets regulated.
Thank you very much, ma'am. And ma'am, what are the methods to evaluate this stress? And this method should be individualized for each and every couples to assess this amount of stress?
Yeah, there are various questionnaires. One of our the PhD candidate is doing this one study on the stress levels, and she's validating the questionnaire, and she's also measuring the serum cortisol level. Once we have some data, we will be able to publish that. There are various methods. The questionnaires are available. That is what I was telling you. If you go to the various psychotherapies and all those, there are various validated questionnaires. So before we submit these couple, first you should know what type of stress and what is the reason for the stress, whether it is the social background or it is the economical background. You will have to assess that and individualize your stress therapy. It cannot be a blanket treatment for everyone. So before we start, initially detailed history when we are taking and the examination, maybe the first episode or first visit, they may not tell everything. So as they come with the repeated visits, so you also get to know about it. And when you are counseling them about all this, then they will be able to tell you, so you can individualize. It is not a blanket therapy. It has to be individualized.
Thank you very much, madam. And ma'am, if you identified that there is obviously some stress for that particular individual couple, so what will be the management approach? How can you reduce the stress further going forward?
See, that is what I have been telling you. There are so many cognitive behavioral therapies and the psychotherapies, group therapies, and so on. So they can go hand in hand probably with the IVF treatment. So I cannot tell the patient, you reduce your stress levels and come back after 6 months. That is not the ideal way of answering them. So usually when they are coming for an IVF treatment, they don't start the treatment the very next day. So they come for the investigations. There is some amount of time, say probably 3 to 4 weeks time. So probably that is the time where you can counsel them. They can go for this meditation, yoga, which is not going to affect the treatment. So they can go hand in hand with the IVF treatment.
Thank you very much, madam. So thank you very much, madam. I could not find any other questions. So if you allow us, then we can conclude this today's session.
Thank you. Thank you so much to Dr. Stalin and all the organizing members for giving me this opportunity. Thank you very much.
Thank you very much, madam. And thank you once again for your valuable time to discuss this important topic and for addressing all the questions. So thank you very much, ma'am. In future also, we look forward for some high-level session with you. So thank you very much, ma'am, and have a good day.
Welcome. Thank you very much.